Yes, sir, it is.
Am I audible clearly?
Yeah. Yes.
Okay. So a warm welcome to my dear students of respected Dr. Krishna sir, the host of this session, Dr. Sridhar, all the respected faculty members, all the authorities of AVP Coimbatore, and everyone assembled here to have some knowledge exchange, which is deemed to happen today. So before venturing into that, let me pay my very humble, respected tribute to Dr. P.R. Krishna sir. The last Tatwaprakashini, he was there with us, and now also I feel his presence. When I came there and I was talking to him, and he was showing me one ulcer in his leg, and I finally asked him whether what guides him, what propels him, and whether he is feeling disgusted because of the repeated attack of diseases. Then his reply was, my body is suffering, I am not. I am not suffering, my body is suffering. So he always dissociated his body, his physical body, from his karmas. So likewise, his physical body has now separated, but still his Atma is there with us, guiding us, and also giving us the strength to move forward, as well as prompting us to do wonderful things. And one more thing I want to share about him was his nature of doing everything with a killer instinct. He was very particular in delivering or to ensuring the quality of delivery of everything. I remember the time when Sir was speaking with Prime Minister regarding COVID-19. How specific was him? He had arranged the points well, presented it very well, and he finished it within time. So he was a very accurate personality. He is actually a person who will do what he say. And also, I got a chance to read the letter written by him to all the students to wake up early in the morning and to be with him in the satsang. And I could say that, and the last line of the letter was the thing which attracted me mostly. His mentality to connect with everyone. The last line was saying that even if you cannot rise up early in the morning, as I have instructed you, let we be continue as friends. Let us be friends, even if you are not taking my word and waking up in the morning. So he was such a personality. He is having universal compassion. He is having brotherhood, friendship. Even though he is a director, he is a great man. He was standing above the crowd. He was ready to mingle with everyone and to connect with everyone instantaneously. So before starting on to my session, let me pay my very humble tribute to his departed soul. And coming to the topic of my presentation, let me introduce the topic which I have selected to talk to you, interact with you, is to explore Chikitsa from the vantage point of Kasa. So vantage point means a point where you are very comfortable, or it seems to explore something from where you have to start, or to explore something where you have to stand. What is your perspective? So the term vantage point simply means an ideal place from where you can have a friendly conversation, a friendly perspective likewise. So I want to explore Chikitsa Sthanam, but I want to explore it from the basis of Kasa. So Kasa Chikitsa will be my vantage point in explaining the Chikitsa Sthanam to you. Why I have selected this topic? Why? Because I have seen that the introduction to Ayurveda happens not from Chikitsa Sthanam, but introduction to clinical practice happens from Chikitsa Sthanam itself. So till graduation, one has to reach the Samhita, starting from Sutrasthanam, Shariram, Nidanam, then finally getting into Chikitsa. I am telling about the important sthanas through which all practitioners are going through. But what I felt that after getting graduated, when one got exposed totally to all the sthanas, then when one get initiated into clinical practice, one should start reading Chikitsa Sthanam regularly, then go back to Nidana Sthanam, then to Shariram, then to Sutram, regularly in a day. So the point of importance in my presentation is regarding the different aspects of Chikitsa, and and to raise certain questions whether we are following the essence of what has been described in the Chikitsa Sthana. So before going directly into my presentation, let me show you a comparison from an Ayurvedic viewpoint regarding capsicum and red chili. Many a time it has been told that Ayurveda is best experienced in kitchen. When you enter into kitchen, when you see the different objects which are placed there, when you experience it, its taste, its smell, everything, you can gradually experience Ayurveda, its principles, because the principles of Ayurveda is something which is really connected to our day-to-day life. So, from an Ayurvedist viewpoint, the capsicum is a Thulam, Saumya, minimal Ushna, a shade-loving plant. And it is when I get into its some agricultural points, I got an interesting finding that it is usually sown in winter or early spring. It represents more cover power. But when compared to red chili, but red chili is directly opposite. It is sukshmam, it is tikshnam, fiery ushnam, it is unloving, and mostly it is sown in summer. See, one is excessively pitta, the other is stula, manda, and kapha. We all love capsicum, whereas we all fear the presence of red chili. And even I have came across another type of red chili called Kashmiri chili, which is actually not so pungent as this fiery red chili, because it is grown in a place which is predominantly cold. So all those aspects, this is an experience. We are going through an experience. We are experiencing the difference between capsicum and red chili. And many a time I used to think that why not in the first year, why not can we open a laboratory called Ayurvedic Experiential Laboratory, wherein all those things which we use in day-to-day life can be experienced with respect to gunas, and it will lead to more critical understanding of our science. Why I am telling is this: learning fundamentals is experiencing ourselves, experiencing the nature around ourselves, and to trying to connect between the nature and us. So we are the point of reference. We are experiencing everything. Learning fundamentals or learning samhitas many a time in the first year happens to be rote learning of slogas. Instead, it shall be experiencing Ayurveda. So as far as examination is concerned, you have to learn the sloga, but after getting graduated, when you read fundamentals, we may try to experience it. So then only we will be getting totally convinced. And how can we experience ourselves Ayurveda? One simple questionnaire will help you. When you wake up, an experience of today, with respect to the basic principles I am speaking, just we are thinking, how was my sleep and what was my dreams? What was the bowel pattern? What was the first taste which we felt in the mouth? Am I feeling whether I got a feeling of hungriness when I was waking up? What happened to appetite after my bath? What was my mood in this day? And specifically, what you felt on putting fresh clothes after the bath? These are all experiences which are linked somewhere to our samhitas. And there also another opportunity for Ayurvedists to experience the nature, because the nature is the changes happening in nature is very beautifully portrayed in our samhitas. When you read Susruta Samhita regarding the changes in the Ritu, Susruta has very well portrayed the nature of change of flowering pattern of the plants, the changes in the pattern of insects, birds, the pattern of sky, everything has been beautifully displayed. So what remains is just to experience. And experiencing ourselves in nature, we can see that we being the reference point, we are experiencing the nature, we can place ourselves in nature, and we can see throughout the season. When you experience yourself throughout a year, you can see how your appetite changed through the season. What was the appetite pattern in winter? What was there in summer? What was my sleep pattern? When was I when was I am getting up very early in the morning? Whether it was in summer, whether it was in winter or in rainy season. What was the changes in pattern of your sexual energies? So everything related to this can be experienced. The fundamental principles of Ayurveda can be experienced. And when you reach a level of experience, when you start experiencing the external environment using Ayurvedic principles, you will get into a stage where you will start getting intuitions. And when you are training your intuitions, you will become a best subjective diagnostic specialist. And if you can add on the newly evolving technological diagnosis along with that subjective sensation of picking up diseases, you will be an excellent diagnostician. For example, when you are going to a place and you see a patient with fever, and you are subtly observing the patient and you are asking the patient whether he is getting smell or not, and the patient says he or she is not feeling any smell at all, you suspect the occurrence of attack of COVID-19 virus. And if you have a good knowledge of a diagnostic test for that, you can send the patient. So you have experienced both. You can have an objective test, you can have a subjective diagnosis. Ayurveda is offering a very broad canvas for subjective diagnosis, and it can be spiced up by using objective diagnostic skills. This was a topic which I have talked in the previous Tatwaprakashini. And there comes a transition point. So in the left, you can see a potter building up a clay pot, and by using his hands. So whenever he uses his hands to build a pitch, what happens? He got a very beautiful experience of that sand and that clay in his hands. So he's having an immersive and experiential approach to clay the pot making. Whereas coming to the delivery point, you have to offer the services very precisely in a clinical situation. So what happens at the delivery point? In the right side, you can see the delivery point. It is the clinician's room, wherein you have experienced the nature, you have experienced Ayurveda, you have learned the fundamental principles, you have learned the intuitive and objective diagnostic principles, and now you are sitting in the clinician's room, and there you are being greeted by a patient who wants a solution to his problem, and where you are supposed to apply your experiential skills in a specific situation happened to a particular individual. And my question is, are we delivering the needed results at the delivery point? Or are we communicating the needed things there? So these are the two important things. Whether we are satisfying the patients, whether our delivery point technology is fine, whether we are giving the needed results which are asked by the patient. Many a time we feel that with the existing situation, we are not able to deliver what has been needed by what has been required by the patient, either in the communication level or in the therapeutic level. So what happens? So if you put an inquiry regarding what happens at the delivery point, you can see that we are battling with a huge arena of diseases by using less weaponry. Our weapons, our medicines, which we use currently, is just a tip of the iceberg. I would say that more than 98% of the medicines, more than 98% of the therapeutic formulations are lying sleeping in the textbooks. So if you have having the support of all those medications, you will be doing wonderful. But in order to identify, in order to start practicing medicines which are mentioned in the Chikitsa Sthanam, you have to read the Chikitsa Sthanam thoroughly. You have to explore the Chikitsa Sthanam thoroughly. And that's the core of this presentation. How to start exploring Chikitsa Sthanam from the basis of Nidhanam, Shariram and Sutrasthanam. And Chikitsa Sthanam happens to be the most evolved manifestation of the principles of Ayurveda. See, being a doctor, our fundamental and the base duty is to offer suffering, offer cure to a suffering, offer solace to a patient. So, whenever you are supposed to offer solace to a patient with Ayurveda, with all those knowledge which you have learned through Sutra, Sharira, Nidana, Chikitsa, etc., the Chikitsa Sthanam happens to be the point where you need to deliver your knowledge. So, the Chikitsa Sthanam happens to be the branches, the canopy of a big tree, whereas the roots happens to be Sutra Sthanam and Sharira Sthanam. The central area, the central wood which hangs all these branches, which is connected to the root, happens to be the Nidana Sthanam. I want to picture it like that. The Chikitsa Sthanam touches the lives of people directly, but are we reading it in the needed way? Nowadays, we are having a lot of seminars which are giving more focus on the reading of Sutra Sthanam and other fundamental areas. But what I feel as a lacuna is we are not reading the Chikitsa Sthanam, understanding it in the way it is needed. So I started myself an attempt to read the Chikitsa Sthanam in a way that I can practice it directly into clinics by discovering or rediscovering the therapeutic formulations, trying to make it in the pharmacy and then giving it to the patients. And for that, as I told you earlier, I have taken Kasam as the subject. So Kasam is a clinical syndrome in which Kasanam is the important manifestation. Kasanam means Shirakanda Urthva Vada Prasarana. So it is a reflex response through which something is expelled out of the respiratory tract, Pranavaha Srotas. And one among the most important complaints for a patient visit to an Ayurvedist happens to be Kasam. People come and tell you about different varieties of Kasam. And you should remember that we are focusing on Abhyantara Vigruti Parampara and not the Lakshana. So I'm going to talk about Kasam, which is not a single clinical syndrome. I'm going to talk about Kasam, which is a clinical syndrome, which is connected with many other diseases. And where the Kasam manifests is another important thing. Uras, as all of us know, it is a Kaphasthanam. It is the playground of Udana and Pranavada. Avalambal Kapham is near it. Neighboring Mahamarma, Hridayam is located. Pranavaha Srodho Moolam. All those things you are knowing very well. And what are the major presentations happening here? People will come and tell you, very usually, cough with either dry nature or productive nature. Cough with the pain in flanks and chest. Sometimes, if it is a productive sputum, the people will tell you, the patient will tell you that there is thick yellowish sputum coming. Somebody else will come and tell you white frothy sputum happens. Expulsion of caste will be the symptom presented by someone else. And some people will come and tell you that with each cough, there will be an easy bout of sputum production, with easy expulsion of sputum. Sputum expulsion happens to be difficult even after repeated strenuous attempts, and that causes severe flank pain. Many people are complaining like that. Somebody will come with you along with the Kasam. They will be having fever. Somebody will be having associated dyspnea. Somebody will be having proper appetite, bowel movement or not. So all these happens regularly in our clinics. Somebody will be having cough immediately after food. Somebody having Kasam triggered by smoke, smells, etc. Somebody coughs up in night time and in winter evenings. Whereas somebody will be, some sort of patients will be having problem only in the early morning, and when the sun is going up, the Kasam comes down. Somebody will be complaining you that after doing a strenuous exercise in the morning, they will be having onset of cough, which ends in asthma, stress induced or exercise induced asthma. So yeah, in such a variety way, the cough is getting presented in our OPD. We are, all of you who practice in the day-to-day clinics, you will be getting some sort of patients. See, in addition to that, many of the cities today, main metro cities, for example, in our national capital region, New Delhi, what happens? There is severe pollution. So every other person suffers from some or other type of coughing. So cough happens to be a part of our daily clinical spectrum. And the pattern in chronic cough, what happens in chronic cough? So the point of interest for us is chronic cough. Even the acute cough is well managed by Ayurveda people, whereas the chronic cough interests us because the patient is persisting with the same complaints even after changing the medications. Or some pathogenic process is going inside, which is having a wider base, a chronic onset, and it has been with the patient for a long period. So what happens there in a chronic cough? In chronic cough, the airway reflex response to the airway is trying to expel out something. And you can see that in many of the cases of chronic cough, there will be some nidana which causes chronic mucosal inflammation. Chronic mucosal inflammation. And when this inflammation happens, you can see that after so many months or years, when the patient is going through this chronic inflammation, what happens is the airway happens to become hyper-responsive. This sometimes happens just immediately after a viral attack. So we will term it post-viral mucosal hyperresponsiveness. It is very usual to say that many patients with the COVID-19, after their after their situation is getting negative, they start to have a hyperresponsive respiratory mucosa. So this respiratory hyperresponsiveness is triggered by a chronic inflammatory mechanism happening in the mucosal layer. And what, as an Ayurvedist, we can perceive from this? Inflammation, simply speaking, inflammation means an interplay of Pitta and Kapha. Pitta and Kapha dosha, which will be modified later by Vada. But I feel that there is interplay of Pitta and Kapha dosha. You can see that Pittam is Sasneham, Kapham is Sneham, Snigtham. Pittam is Saram and Dravam, but Kapham is Thiram. Pittam is Ushnam, Kapham is Shidam. So in some way or another, if there is a vitiation happening to Kapha and Kapham starts to become more Dravam, it tends to be like Pitta. The only exception will be it is Shida, Pitta is Ushna. So there is a matching between Pitta and Kapha dosha when vitiation happens, and they can combinedly vitiate and create inflammation. And when inflammation happens regularly in the mucosa, what will happen later on? The stage will be transforming slowly and slowly into the area of Vata. So as the inflammation progresses, the Snigdha Bhava of Kapha will be gradually reduced to Ruksha Bhava of Vata. How this happens? How this mechanism happens? The answer lies in the Samprapti of Shidadi Jwara. So in Shidadi Jwara, there is a statement that Shidado Tatra Pittena Kaphe Sindhida Shushide. You can see that here I have mentioned three doshas, Pitta, Kapha and Vata. Pitta is Ushna and Sasnigdha. When Pitta combines with the Kapha, what happens? Kapha gets the Snigdha Bhava, it becomes more Snigdha. Because of Ushna of Pitta, the Sthira Guna of Kapha is lost and Kapham becomes more Dravam. And when Kapham becomes more Snigdham, more Dravam, we will say it became Sindhidam. Sindhidam. Sindhidam means it becomes more, it is having a tendency to move. Kapha should not be having a tendency to move. If Kapha starts moving, it's detrimental. You can see as it happens in the case of Prameham. In Prameham, Bahudrava Sleshma is Dosha Vishesha. And gradually this inflammatory mechanism is moving on with interplay between Pitta and Kapha, wherein the Ushna Guna of Pitta causes Sendana of Kapha. But gradually what happens? Vada sets in. Vada comes into the field, and because of the presence of Vada dosha, Gradually, the Sindhita Kapha happens to be Shoshita Kapha because of the interplay of Shida and Ruksha Guna over Sindhita Kapha. So you can see the mechanism. That's a wonderful statement made by Vakpada, Shidado Tatra Pittena, Kaphe Sindhita Shoshide. So Sendhanam and Shoshanam happens to Kapha because of the action of Pitta and Vada respectively. And this is what is meant by Sendhana Shoshana axis, whereby Pitta happens Sendhanam in one direction, whereas Vada happening Shoshanam in the another direction. So, in other words, chronic inflammation of mucosa happens due to several nidana, exposure to environmental factors, exposure to smoke, dust. Many of the people will be having a family history of such diseases. They will be termed as atopic. So there will be a bija dushti, there will be a consequent srodo dushti, and this srodo dushti, when exposed to the nidana factors, because of certain ahara visheshan, if the patient is taking curd in the night, or if he is a person who is having a regular day sleep, or if the person is having a late night food. So all those factors will trigger or it will create an imbalance in the interaction between Pittam and Kapham, leading to more Sendhanam. Many of the diseases are having very amusing triggers. I have met one person with interstitial lung disease. He was very healthy, but I think he was having a bija dushti, and he happened to go to a tea garden, a tea plantation as an estate supervisor. And because of the exposure to cold, as well as he says, because of the exposure to the fertilizers which are sprayed on the tea plantation, he started having interstitial lung disease. So something triggers inflammation inside. Chronic inflammation is triggered by a variety of diet, lifestyle factors. And when kapha sindhanam happens, productive cough ensues. When kapha soshanam happens, dry cough ensues. And in later stages, there happens to be chances of gas production, which is known as khanaskleshma. So coming to Paitya Kasa protocols, which is described in the Chikitsa Sthanam, you can see that I have earlier requested the officials to tell you and to take Ashtangridayam Chikitsa Sthanam with you. And you can see in Chikitsa Sthanam, the 25th slokam in Kasa Chikitsa, you can see Pitta Kase tu Sakave Sarpisha, Vamanam Sarpishahidam, Vamanam Sarpishahidam. So there are three stages. Why I am focusing on Paitya Kasa? Why? Because here the Nidana has got in chronic inflammation, the Nidana has triggered Pitta, which causes Sendhana of Kapha, later Shoshana by Vada. So we are now trying to decipher how this is happening. And now we found that even for Paitya Kasam, there are three different doshic coordinates. The first coordinate is Paitya Kasam Sakapam. Sakapam here means profuse kapam. Utkleshita kapam. So Acharya says you do Vamanam, but not with the Madana Pippali Kashayam. It should be instead, it should be done by using Sarpis. In that slogam, it is specifically mentioned. Why? Because we are operating on Kasam. We are operating on Uras. So if Vamanam happens, all the Utkleshita kapam is being expelled, and there is a potential of triggering of Vada dosham. So he says there is the chance of triggering of Vada dosham. So use Sarpis for Vamana. The another doshik coordinate or doshik status is Pitta Kasam Tanu Kapam. Tanu Kapam means very slow, very mild sputum expulsion. So we can picturize it as Vada Kapha Anubandhavastha. Vadam with Kaphanubandham. Here, Paitya Kasam, there is presence of Vadam which dries the sputum, but there is Kaphanubandhitam because it is Tanu. Here, Acharya says Virejanam should be done with Mathura Devya. See the permutation and combination. See the next doshi coordinate. Here you can see Khana Kapam. Khana Kapam means there is obstruction, blocked Kapam, or the formation of casts. Here it is Shoshita Kaphanubandham. Pitta Kasam Shoshita Kaphanugandha. It is known as Khana Kapha. So the Virejanam should be done with the Tikta Rasa Dravya. So the common factor is Virejana Dravya, that is Trivurt. But in the case of Tanu Kapha, you can use Draksha because Acharya says you can do Virejanam with Madhuri Rasa Dravya. Trivurt coupled with Draksha Kashaya, you can give. But in the case of Khanagabham, the same Virejanam with the Trivurt should be added with the Tiktam. Because why? Why? Because here there is Khanagabham. So the Khanagabham should not be given Madhuri Rasa for Virejanam. Why? Because it will increase the Khanatva. Whereas Tikta Rasam will try to dislodge the compact Kapha. The Tikta, Kashaya Tikta Rasa, Kashaya Tikta Madhura are the three rasas which will destroy Pitta, but regarding its influence on Kapha, Tikta Rasa is better to deal with the Khana Kapha. So Padoladi Gana Virejanam will be a choice. So in Paitya Kasa, simply when I speak about Paitya Kasa, if there are three different stages of Paitya Kasa, if it is profuse Utkleshita Kapha going for Vamana with the surface, if it is Tanu Kapha going for Virejanam with Madhurya Rasa Dravya, or if it is Khana Kapha going for Virejana with the Tikta Rasa Dravya. And you can see wonderfully that even in the Samsarjana protocol, after doing this Shodhanam, there is differentiation. See, in the case of Sakabha, Paitya Kasa, after Vamanam, in Sakabha, the Vamanam is the best Shodhana option. So after Vamanam, you are advised to give Shida Madhura Sniktha Samsarjana. Shida Madhura Sniktha Samsarjana. Why? Because after Kapha Chedanam, the Kapha is very well Utklesida. So if you give Vamana, the Vamana is executed in the best possible way. There is a chance of Vada Vritti. So after that, Madhura Sniktha Dravya is advised. Then you will be suspecting why Shida Dravya is placed, because this is Paitya Kasa. And in the case of Khanagapam, the Shida Dravya is mandatory, but after Virejanam, the patient is advised to give Tikta Ruksha Dravya. Tikta Ruksha Dravya in order to reduce the compactness of Kapha. So in one side you are having Shida Madhura Sniktha Dravya, maybe Shali rice can be used for making Peya in Samsarjana Krama, whereas in Khanagapha you can use Peya prepared with the Yava. So there are two different options. See the creativity which has been embedded in the Chikitsa Sthanam. So whenever in Chikitsa Sthanam, if some Shodhana is prescribed, after that immediately, if the disease needs a special attention, if the doshic status needs a special attention, the Samsarjana Krama is specifically mentioned. So when you have doubt which dravya need to be used, you have to go back to Sutra Sthanam to find references regarding specific drugs. So you stand on Chikitsa Sthanam, extend your exploration to other sthanas. Then there are some good lehyas which are mentioned, which are examples of fine craftsmanship. See, Mridviga. In Paityagasam, of course, it is Paitigam. Mridviga is best. But it is Shidam and Madhuram. There is a chance of Kaphavarthanam. So, along with that, Pipali is added. Pipali is Kadurasam, Ushnam, Kabaharam, but it is Madhura Vipagam. And so there is least tendency of triggering Pitta. Then you can see additional one palam of Sarkara is added in this lehyam, and it happens to be anilomanam, and additionally it is being added with the honey, which is Kapha Chedana. So it happens to be a comprehensive approach. So crafting a lehyam is an art in itself. So placing a drug, placing a counteracting drug, then giving Vadanilomanam. See, in Kasam, Vadanilomanam is a must. We will see that in Ashtanga Sangraham, Abanavada Dushti is mentioned as a specific cause of Kasam. So, Vadanilomanam is a must. Kabhachedanam is a must. Pitta Haramitvam is a must. Pitta Pragobana Pradihadam is a must. So, preventing Pitta Pragobanam, Kabaharam, Vada and Lomanam, everything is a target, and it has been beautifully combined together into the yoga of Mudvikadi. Then comes Togeradi Lehyam. It says two indications alone. Hrudroga Kasahara. It is mentioned in Paitya Kasam. So I suspect that they are mentioning Paitya Hrudroga. Paitya Hrudrogam, many a time, if you go through the symptoms of Paitya Hrudrogam, you can see that many of the symptoms belong to the spectrum of gastrointestinal diseases. So many a time, it can be defined as precordial pain or precordial features which are associated with the gastric symptoms like GERD. So Togeradi Lehyam will be working in a person with gastric symptoms like gastroesophageal reflux along with the kasam. And many a time you can see that the kasam happens to be in a patient which is happening to be in a chronic fashion, and you have to probe whether any gastric symptoms are causing kasam. And many a time GRD patients will be presenting you with kasam, and you have to manage GRD first, the gastrointestinal symptoms first, the Koshtagada Amlapitta like symptoms first. Thereafter, the kasam will be subsided. So Togeladi Lehyam, I think, is a beautiful combination directed towards such symptoms. And now consider the diet protocol for Paitya Kasam. It's wonderfully crafted. See, there also the distinction between Tanu Kapham and Khana Kapham is maintained. For Tanu Kapham, we want Pitta Haratvam, prevention of Vada Pragopam. So there is addition of Shali, Shashtigam, along with Mamsarasam, along with Sarkarambu. Acharya is very specific. So you can give Mamsarasam, you can give Shali, Shashtiga. These are advised as cereals. Then for Khanakapam, your priority is Pitta Haratvam along with Kava Haratvam, prevention of Vada Pragopam. So you have to be balanced. You have to opt Kavahara Sabhava Drevya, which are not Pitta Varthaga. So Yavam, Syamagam, Kodravam are taken. Along with that, Mudgayusham, which is having a tendency of Pitta Kavaharatvam, is added. Tikta Shagam is specifically advised. Why? Because while using Yavam, Syamagam, Kodravam, there is a chance of Pitta Pragopana. So Tikta Shagam, if you advise along with that, it will reduce the augmented Pitta. And the advice is for Madhura Jangala Mamsarasam. Madhura Jangala Mamsarasam, specific Jangala Mamsarasam. Why? Because it is Khanakapam. So the principles are beautifully connected together, even to prepare a dietary protocol. Another situation is there. If it proceeds to Shoshana stage, what happens if Shoshana stage ensues? If there is Vada predominance, you can see Vadiga Hasam. Vadiga Hasam, the specific mentioning, the protocol is to start Snehapanam if Agni is optimum. And you can see a wonderful Kridam there, Guruji Kandagari Swarasa Kridam. It is not available in market, I think, but there are only two components, Guluji and Kandagari. So we will be thinking why Acharya has prescribed Guluji here. Why Kandagari we can approve? Because Kandagari, we all are familiar in drugs which are mentioned along with the Pranavaha Sroto Vigara. But why Guluji? Because this background of inflammation is there. I think so. Because when Guluji is being prescribed, it is Shida Virya, it is Tikta Rasa, it is Pajana, and it is Pitta Rakta Hara. So Pitta Rakta Hara Swabhavam, Kleda Shoshanam, everything is there with the Guluji. So Guluji and Kandagari is used, their Swarasa is used to prepare a Krida. And in Vadi Kasam, you have to search for Pittanibandhitam if there is any Anibandhata dosha. If there is a feeble, mild yellowish sputum is being produced with a dry cough, you can sense the presence of Pitta. Or if there is a Paratantra Pitta Lakshana like Tiktasitvam, Vidahitvam, etc., then also you can sense the presence of Pitta. The treatment is Urtha Bhaktika Krida or Kshirapana. See how the Krida is administered. Acharya says not to give Krida directly. Instead, after taking food, above the food, Krida Bana is advised or Kshirapana is advised. Because there is a chance of Pitta vitiation in the upcoming Vidaha Samaya. When the food is being metabolized, there is a tendency of pitta vitiation. So in order to counteract even that vitiation, Acharya says to place the Krida or Kshira after giving food. And in Vadikasam, you can trace Anubandha Kaham also. There is mild loose sputum. If the patient is presenting very mild loose sputum, nor it is Utkrishtam, nor it is Samutkrishtam. It is not Vrutham, it is not Utklesitam. So you cannot expel it out as you have done in Paityagasam, Sakapham. In Vadyagasam, the Kapham is naturally very Shushkidam, Shoshidam. So there is no chance of doing Vamana. If you have to do Vamanam, the indication is very clear in Jwaram, wherein it is being said that Tatra Utklishte, Samutkrishte, Kahapraye, Chale Male. So Chalatvam, Utklishtam and Samutkrishtam is the essential requirements to do Vamanam. So here the advice is to go for Sneha Virajana, which is not causing vitiation of Vada. So in every way, the doshas are being balanced. And you will be mesmerized to see the presence of 5 different Krida Yoga, which is mentioned only in the single Prakarana of Vadikasam. 5 different Krida Yoga. That means there are 5 different types. There will be 5 different types of Vadikasam. Even the Vadikasam will be of 5 different types. If it is a single type, there can be only one drug. So here 5 different types of medicines are advised, 5 different types of Krida is advised. The first one I have introduced to you, Guluji Kantagari Kridam. Then comes Kshara Rasna Kridam. Kshara Rasna Kridam is mentioned for Kaphanibandham. Then comes Rasna Dasamulam, which is very severe Vada predominance. You can see Panjagasan. Then it's Panjagasan Chirakambam Yoni Vamshna Vedanam. Sarvanga Eganga Rogamscha. So that comes under the indication of Rasna Dasamulam Kridam. So it will be mentioning about a situation where Vada is highly predominant. Then Vidaryadi Gana Kridam, which is Vada Pitta Haram. Then there is a powerful Kridam mentioned there. It is Ashoga Bijadi Kridam. Why I am telling it is powerful? Because when I assessed its combination, I can see that there is Ashoga Bijam. Then there is Vidangam. Then there is Patmagam. Then Anjanam. So it's a combination which is not usually seen. I suppose it is a Kridam which is mentioned for Pitta Kapha Haram because of the presence of Ashoga Bijam as well as Vidangam. And there are certain complex doshic situations which you will encounter in your clinical life, wherein Pitta and Kapha is causing parenchymal inflammation and fibrosis simultaneously, as we shall see in the case of interstitial lung disease, in idiopathic pulmonary fibrosis, etc. And also in acute post-infectious consolidations like pneumonia, you can see simultaneously Pitta is causing Syandanam, Vada is causing Shoshana. So there is parenchymal inflammation happening, parenchymal fibrosis happening. So if you have to tackle both, you need to tackle Pitta, Kapha and Vada together. For that purpose, such Kridas are very employable. And coming to the Kabaja Kasa protocol, a special type of preparation is mentioned, Devadara Sneham. How the Devadara Sneham is extracted? It is by burning a piece of Devadara. And to that Sneham, that Thailam, you have to add Yavaksharam and Yosham. And this has been specifically mentioned for Snehavana. In Kaphagasam, you will encounter Kaphagasam while you will manage patients with the bronchitis, likewise clinical conditions. And Vamanam, Virajanam, Nasyam are all indicated. See, remember, forget all those chronic conditions like bronchitis. Somebody will be having chronic sinusitis. So what I feel that this type of Kridavana is must there. The patients will be coming to us, we will be treating, the patients will be getting better. But even after having a late night food or exposure to AC in the car, or just they are having an exposure to rain, they will come to you back with the same presentation. So in such cases of Kavaja Kasa, where there is a kapha predominance. Vamana, Virejana, Nasya are indicated. Sasneha, Ushna, Ruksha, Kadu Pradhana Samsarjana. See the beauty. The Samsarjanam should be Sasneham. Why? Because Vadam should not get aggravated. It should be Ushna Ruksham to mitigate Kapham. It should be Kadu Pradhanam to mitigate Kapham. And this is the pattern of Samsarjana Kramam mentioned here. So I think the use of some substances like barley, ragi, etc. Added with the Kadurasa Pradhana Dravya as curries and served Ushna. So in this particular way, you can manage this Samsarjana Krama. So I am in search for finding out such Samsarjana Krama which can be readily used in the bedside. But it is very difficult. Acharya has given guidelines only. And he has mentioned a Panajalam specifically for Kaphagasam. It is Dashamula Panajalam. Dashamulambu Sadhidam. It has been mentioned. So Panajalam is Dashamulambu Siddham. Samsarjanam should be Sasneha, Ushna, Ruksha, Kadu Prathana Samsarjanam. And now comes a beautiful crafting of yoga. You can see two clinical conditions, Vata Kasa, Kaphanubandha, and Kabhagasa, Vadanubandha. This reference is there in Ashtanga Sangraha. So in the topmost, you can see Vidanga. This is a Churna Yoga which is mentioned for Vadakasa Kaphanubandha and Kabhagasa Vadanubandha. You can see Vidangam in the topmost layer. And in the bottom, there is Hingu and Saindava. This is common for both. See, in Vadyagasam, they are using Nagaram, Rasna, and Pippali. Nagaram, Rasna, and Pippali, they are having Madhura Vibhagam. So that will be pacifying Vada. And they are having an effect, I suppose, on the Koshtam also. In the Koshtam, they can bring about Anulomanam. So Vada Kasa, Kaphanubandha, Kapha is managed by Vidangam, Hingu, and Saindava. In Kapha Kasa, Vadanubandha, you can see, in order to mitigate Kapham, specifically three specific Kavahara Dravya are used, Yosham, Kushtam, and Manasila. So the axis of this formulation happens to be Vidangam, Hingu, and Saindavam, whereas the as per the dosha, the central area is only changed. In one area, you can see Nagaram, Rasna, and Pippali. On in the other area, you can see Yosham, Kushtam, and Manasila. See, Nagaram, Rasna, and Pippali, these three are not Vada Pragopaga. They are they will not create provocation of Vada, but they will bring the Kapha down. So in such a way, the Yoga is being connected to, or the Yogam, the Dosham, the Aushadam, its Rasaguna Virya Vibhaga are beautifully connected. And another interesting can be homemade yogam is mentioned here. See, you can see in that yogam, I will read that yogam. Dve pale dadima dashto, 51st slogam. Dve pale dadima dashto, gudad vyoshad palatrayam, rojanam deevanam swaryam pinasa swasa kasajit. See, there are only three components which you have to crush together: dadimam, vyosham, and gudam. Dadimam is Amla Rasa Dravya, but not Pitta Govana. Vyosham Kabaharam and Gudam Anulomanam. See, they are mentioned for managing penasam, swasam, and kasam. I will translate it as allergic rhinitis, or allergic rhinitis sometimes progressing to bronchial asthma. But this yogam can be employed only after the initial set of medications which are given to clear off the excess amount of mucus, etc., which is present there. But this yogam can be used for a long period, I think, which will reduce the sensitivity of mucosa. And another good grida is also mentioned. Vidanga Vyosha Garbha Grida is specifically mentioned for Vada Gabhagasam. Vidangam and Vyosham are used in the preparation of grida. And I have seen a wonderful yogam here. You just read it, you can see that Pippali Kalkam is taken. You marinate the Pippali Kalkam in Tiladaila. Mix it with the Siddha. Then take this preparation along with the Kulatha Kwada. See the mastery in crafting this yoga. So, see, you can see Pipali is Sushnam, Kadurasam, and Madhura Vibhagam. You are marinating it in Tiladailam, or I think the word is wrong. Not it is marinating, it is sorting it in Tiladailam. It will cause Vada Kapha Shamanam. Mixing it with the Siddha, it is Pitta Shamanam. And drinking the combination in Kulatha Kadam, it is expressly Kapha Shamanam. It is Ruksham Kapha Shamanam. So in managing Kaphaja Kasa, this yoga will work in a wonderful way without causing the provocation of other doshas. And one yoga with multiple pathologies are seen here. One important example is Punarnava Shivadiga Krita. Shivadiga is mentioned as the white variety of Punarnava. See, the indication is Na Kasa Vishama Jwara Kshaya Gudangurebhyo Bhayam. See the reference is there. The yoga is 58th yoga, 58th slogam. Kasam, Vishamajvaram, Shayam, and Arsas. So this is an earthquake-like situation. You have got Kasam, you have got Vishamajvaram, then you are happened with the Shayam, and above all, you are having Arsas. So where comes the epicenter of this earthquake? The epicenter of this pathogenesis may be a Lina dosham with Abanavada Prandiromya. You might be remembering in Lina dosham, if a person is having Lina dosham, there are three chances. Either he will be becoming Karsyam day by day, his complexion will be getting reduced day by day, and the third one, he is becoming more and more inactive day by day. So here there is Shaya. Here there is Vishamajvara. Here there is Kasam and Arsas. So in such a condition where a patient is coming to you with a chronic bronchitis or COPD, etc., this may be the clinical situation which the Krida will be working for. I think so. And then comes the Vyakradi Lehyam. Here also, see Gulma, Hridroga, Arsha, Swasa, Kasa, they are the indication. Gulmam, Hridrogam, Arsha, Swasa, Kasa. Just go and read core pulmonale. Core pulmonale is a situation where there is right ventricular hypertrophy because of the pathology happening in the respiratory tree or respiratory bed. So the core pulmonale, there will be right ventricular hypertrophy, and consequently there is reduced flow into the superior vena cava. There will be reduced flow into the hepatic vein. So there will be a consequent affliction of the liver, and in such a way, the portal vein may get obstructed later, and the patient will be presenting with a cough, with the dyspnea, with abdominal distension. Sorry, read it as abdominal distension. So Gulma, Hridroga, Arsha, Swasa, Kasa. All these coming together, you can see in the case of core pulmonale. Whether Vyakradi Lehyam is mentioned for core pulmonale, we have to explore. Now comes the Dhumabana, Manasiladi Dhumam in Bahala Kapam. And the Anubanam is very interesting. Gudayudam, Koshnam, Shiram. See, you are giving Dhumabanam after a Vamanam, especially in conditions with the Bahala Kapam. There is every chance of Vada Vritti to counteract that. Gudayuda, Koshnak, Shiram. Guda is perfect anulomanam. So this is also mentioned for Vada Kapha Kasa. Then comes the commonly asked question in examination, Kshada Kasam, but not seen in clinics. We will be mentioning about Yudhadi Sahasaihi, which is not happening today. Now our chest is not exposed to trauma, just like in the period of Bahubali. Our chest is being exposed to micro trauma like environmental pollution, cigarette smoking, etc. And I suspect, I am not at all sure at what stage we should use the Laksha. Can we use in conditions of hemoptysis? Yes, we can use in the condition of hemoptysis, but whether it is digestible in such a situation, I am not having any experience in giving Laksha for hemoptysis till now. I have seen very important yoga there, Eladi Guliga. Eladi Guliga, the first indication is Rektabittam, then comes Kasam, then comes Swarabhamsam. Why not it is bronchogenic CA? A bronchogenic carcinoma presents with hemoptysis, with loss, hoarseness of voice, and there is the cough. And in Shadakasam, we have studied that there is a progressive depreciation of Kramad Viryam, Ruji, Paktir, Belam, Varnascha Hiyade. All these factors will be depreciating. And different Krida Yoga are mentioned if the Agni is proper. These are very important. Amrita Prasam, Swadamshtra Kridam, Madhugadi Kridam. Just go through that and you can see wonderful indications wherein if the Agni is normal, you can recuperate the patient back. And even though we are having different Kridam, there is differential application of Kridam. See, Kridam is always mentioned for Vada Pitta Avastha. But it is Vada predominant Pitta Nibandha Avastha. That Avastha will be Ryuksham, at a time it will be Tikshnam also. So Krida Panam is mentioned, drinking Kridam, which will be which will result in reducing Ryukshada and Tikshnada of the clinical situation. There is a reverse condition. The reverse condition is Pitta Vada. Pitta predominance, Vada Anubandhitvam. That Pittam mostly, as mentioned from text, I think it is mostly a Sama Pittam, Sasnigdha Avastha. We can see in that stage, if you do Kridapanam, it will increase the Amavastha of that Pittam and that will complicate the situation. So licking of Krida is mentioned there, Lehanam. So Panam and Lehanam is mentioned specifically for two doshic status. So how important is diagnosing the dosha in a Kasa or in any other clinical situation? Because to administer Krida, you have to understand it is Vada Pitta Avastha. But in the same Vada Pitta Avastha, if there is Vada predominance, Pitta Nibandhitvam, and Pitta predominance, Vada Nibandhitvam, the mode of administration is different. And there are different famous yoga there in Shadakasa, Sarpur Gudam, Nagabela Sarpi, Agastira Sayanam with 100 Kadika, and Vasishtha Sayanam, 1001 Haridigi is placed there, 1100 Haridigi is placed there, 1100 Haridigi is placed there. So in this, see Agastira Sayanam and Vasishtha Sayanam. Regarding that, in Agastira Sayanam in our hospital, we have tried preparing Agastira Sayanam in the classical way, whereby Haridagi is being placed inside the Laikyam and the patient is asked to take one Haridagi along with some amount of Laikyam. The result was meticulous. In a patient with a COPD, we got a very good result in administering this. And there are patients in our hospital who is consuming the same Agastira Sayanam for interstitial lung disease and they are getting improvement in pulmonary function tests. So if you are preparing a medicine as mentioned in the Shastra, it will give wonderful results for you. I am convinced of that. Now comes the very, very interesting Sambandhi. Sambandhi is the term which is used for a food product which connects the rice and other curries. So if you want to connect with the cereal, you need a connector. The term Chammandi is used in Malayalam. I think it is a colloquial version of the Sanskrit term called Sambandhi. Sambandhi itself is a curry or it is a powder which is actually a tastemaker. I will translate it as a tastemaker. So here for a Kshadagasa patient, there will be IgG for the patient. So Acharya says Saindava Shundyadi Churnam, which is Ruchyam, Devanam, Belyam. Also Parswarthi Kasahara can be used as a Sambandhi. Even the connecting curry is made medicated in Chikitsa Sthanam. That's why I'm telling Chikitsa Sthanam takes all the magnificent principles of Ayurveda and put in daily practice. So exploring Chikitsa Sthanam means exploring the creativity of those persons who have made even the connecting dish a medicine. Another churnam called a Khandava churnam is also mentioning the same. And coming to Kshayagasa, you can see that in Kshayagasa patient there is Srodorodham, there is Agni Madhyam, there is Tatwaprakashini Madhyam. There will be predominant Dhatu Kshayam. So in that option, you see a patient many a time in the palliative setting lying down with gradual weight loss. The patient is having no appetite to take any food at all. He is very much lethargic, very much kshinida. So your target, the therapeutic target is to do Brahmanam, but concurrently you have to do Agni Vardhanam and Srodosodhanam. If you are doing Brahmanam, sometimes the patient will die. Why? Because there is no Agni at all. If you go on giving drugs which are Agni Vardhanam, that means which are Ushna, Tishna, Ruksha, etc., the patient will again become Sosha. If you go on giving Srodosodhana medication, there is a chance of death of patient. Why? Because his nourishment fails and he will die. So Acharya says, Vyatyasad Kshayagasidhyo. You have to give it concurrently, alternatively, repeatedly. So Brahmanam, Agni Vardhanam and Srodosodhanam need to be administered. A very brilliant formulation I have seen, Vrishya, Vyakri, Guluji, Kridam. See, three components, Vrisham, Vrisham, Vyakri and Guluji. Adalodagam, Vyakri and Guluji. So what are the raw materials? Leaves, fruits, root and leaf bud swarasa and kalka is used for this kridam, and the indication is very specific: kasam, jwaram and aruji. See, while treating patients, I felt that COPD or bronchitis predominant COPD or a CLM, all these presents in a similar way. Kasam, some evening rise of temperature, persistent aruji. Patient doesn't want to take any food at all. We will get all many of the signs and symptoms of Rasapradoshaja Vigara, Asratha, Charujis, Chasya Vairasyam, Arasatnyada, Hrilaso, Gauravam Tantra, all those features will be seen. So here, Vyakri is used, Guluji is used, Adalodagam, Vrisha is also used. So in this combination works well for Srodosodhanam, Vadaharam, Vadanilomanam, then Agnimadhyaharam, everything. So in such a way it is being crafted. Now comes different Krida Yoga also, Chavigadi Kridam. Chavigadi Kridam, on reading you will get an express sensation that it will boost Andaragni and also reduce the Srodo Rodham. Kasamardadi Kridam is there. Dadimadi Kridam, which is another important formulation, wherein Dadimam Amlarasa Pradhanam is used to relieve the Srodo Rodha. So these three Gridas are mentioned as Agni Vardhanam, Srodosodhanam. See, they are not made into Kashayas. Instead, they are made into Grida Yoga. We are giving it to a patient who is Agni, depreciated Agni, diminuted Agni. And in some context, it has been mentioned as Sneha Meva Param Vidyad Durbala Analadevana Nahi Sneha Samithasya Shamayanam Sugurvavi. So Sneham is being taken as a medium to provide those drugs which are Ushna, Krishna, Ruksha, etc. And at times there are certain drugs which have been seen in Vrisha, Guluji, Vyakri, Kridam. In that Kridam, the Guluji is itself is it will prevent Pitta Pragobam, Dhadu Pagam, etc. So in those cases of Kshaya Kasa, etc., there is a chance of Dhadu Pagam and patient death. So in such cases, adding such a drug like Guluji will prevent Dhadu Pagam. All these being done in Grida medium. So Vadaharatvam, Vadanilomanatvam, Kabaharatvam, Srodosodhanam, Agni Devanam, everything packed togetherly. And some complaints which we used to tell about Ayurvedic clinical practice is we are not having standardized protocols as seen in allopathic textbooks like Harrison. If you open the Harrison textbook, you can see a flow chart. Do it like this. How easy, how wonderful it is. We say we are lacking enough information how to handle a clinical situation. We used to say, even though we are having some type of protocol, some type of information, we are lacking a guidance from a guru. What I feel that you make the textbook your guru. We should make like that. We should make Vakada our direct guru. We should collect all the information from our textbooks, and finally we will feel that there are a lot of standardized, personalized protocols which are more advanced than Western medicine available in textbooks like Ashtanga Hridaya. So these standardized protocols, which are at times personal, because it is having so much permutation combinations are prescribed here. So you can choose very personalized protocol for a particular patient regarding his dosage status. So it's very much advantageous for us. So we need to stop our complaints. Everything is mentioned in Chikitsa Sthanam. But we used to play in Kasam only by using Vyafyadi, Dasamula Gadatriyadi, Elaganadi, Tarisabatradi, Yoshadi Vadagam, Agasti Rasayanam, Vasharishtam, Kanagasavam, Kasturi Galperasayanam, such drugs only. We haven't explored a bit further. I am also like that. I'm being practicing continuously for the past 8 years after my PG. Still now, I am not getting enough opportunities to use all those medicines which are mentioned in Chikitsa Sthanam. Once past 2 or 3 months, I tried to prepare Guluji Swarasa Kridam, Guluji Kandagari Swarasa Kridam. I asked my the doctor who is in charge of Ashtangam pharmacy to prepare that. She started, see, you have to prepare Guluji and Kandagari Swarasam. And now she is telling me that the Kandagari in the wet form, not the dried form, is not available. If you want to get Kandagari in the raw green wet form, it should be brought from a nearby Mangalore. So it was a lockdown period. It is very difficult to bring the truck from there. She started inquiring about getting this in big quantity, but there is some problem. See, in this way, there are different difficulties that prevent us from preparing those medicines. But as youngsters, you should read Chikitsa Sthanam regularly, and you should try to encounter with the difficulties, just like what Krishnamar sir has done. He has never escaped from the difficulties or the hurdles. Instead, he faced them boldly. Likewise, we need to face those hurdles boldly, and we have to get out of this spectrum of Yakradi, DMK, Elaganadi, Talisabatradi only. There are a lot other formulations waiting for us. And when you read Kasam, Swasam, Hitma, Rajekshma in Nidana Sthanam as well as Chikitsa Sthanam, you are getting a very comprehensive idea regarding the diseases in the cardiopulmonary spectrum in Ayurveda. So if you want to master the cardiopulmonary spectrum in Ayurveda, you get familiarized with those diseases mentioned in the cardiopulmonary spectrum first, then come back and read Ashtanga Nidana Sthanam, then Chikitsa Sthanam, then you can identify that, oh, this particular yoga is mentioned for cold pulmonary, or this thing will be mentioned for bronchitis. Likewise, the feeling will come up. And if you read, the patient will be coming to you, and the patient, you will be prescribing such specific medication, specific procedure, specific samsarjana kramam, specific nourishment, specific rasayanam, and you will be getting good results. And if all the medicines which are available in the textbook is made available to us, I am very confident that we can manage the diseases starting from simple allergic dry cough. I have written simple allergic dry cough, but I feel that the allergic dry cough is not so simple. It is very difficult to manage. And then bronchitis spectrum we can battle with. Multi-drug resistant pulmonary TB is another important thing which is now coming up. People are having multi-drug resistance for TB, so there will be no option at all. COPD we can manage well. Bronchogenic carcinoma we can manage well. I am telling we can manage well. I'm not telling that we can cure all the persons available, but we can document the results. We can improve our results day by day. We can manage interstitial lung disease, idiopathic pulmonary fibrosis. We can stop the chronic inflammation happening. We can reverse the Shoshida Avastha by giving proper Krida. And also, what not to say, we can manage left ventricular hypertrophy, right ventricular hypertrophy, which is happening due to pulmonary problems, as I have mentioned in core pulmonary. All those factors, even the rhythm correction can be done. The cardiac rhythm correction can be done by giving our proper suitable medications. So that's why I'm mentioning what not we can manage. And how to explore the Samhita after graduation. My advice to you is start reading Chikitsa Sthanam, then come back to Nidana Sthanam for understanding, giving a better clarity regarding the disease at hand. Then go back to the Ayurvedic Sharyam for specific references, Sutra Sthanam for specific references, and be a Prayoga Chadura. Because Vaidya need to be a Prayoga Chadura. On one hand, he need to identify the doshic coordinates. The other hand, you have to give the specific medication for that. So the method is to understand the clinical context, understand the procedures, understand the Shamana Aushadhi, understand the nourishment needed to be provided, and finally the Rasayanam. And in 2020, we got a loss in the form of Krishna Kumarji. And 2019, we suffered another loss in the name of Prakasa. And he was my teacher. He taught me Kasa Chikitsa. And I still remember the days when we took rounds together, when I was a house surgeon along with him, assisting him. And in some beds, he will tell me, Rahul, I will show you how the Samulagadtrayadi is working, at what stage I need to give the Krudam, etc. And he has shown it, shown the text working in the bedside. So he had given me a lot of confidence, and this presentation in Chikitsa Sthanam, I place it in the lotus feet of my sir, Dr. Prakash Mangalaseri sir. And I thank you all, especially the authorities of Ayurveda Pharmacy Coimbatore, for giving me a chance again to come to this prestigious program called Tatwaprakashini, wherein the Tattva is being explored and manifested again and again for all of you. Thank you all for coming here, spending some time with me and hearing me. Thank you once again. Thank you.
Thank you, sir. It was indeed a wonderful PPT with a lot of information that has been shared. As the usual, how you take up the classes. So it was a wonderful session. A lot of information that we have to carry back. I'm sure all of the attendees who were there for today's session is really overwhelmed to get a lot of information and for us to go home back and refer and learn again through it. So that was really wonderful, sir.
Thank you.
I see if there is any questions that our dear participants wants to put forward, kindly drop in the chat box. Maybe we can go through few of them, even though we are running a little bit with the time constraints. So I suppose the chat box is not coming through. So if there is any questions, yes, we have made up a WhatsApp group for the TP 2020 attendees. So if there is any clarifications or doubts or questions that comes from the students, so there is a question.